Hey guys, I'm Dr. Jessica Finley.
And I'm Dr. Jeff Finley.
When someone is pregnant, the demand for high quality nutrients in a mother's body is at an all-time high. This is often why we look for high quality prenatal vitamins. Especially during the first trimester, things such as nausea, morning sickness, they can affect mom's ability to consume adequate nutrition. This is another reason having a high quality prenatal vitamin is so important. A common misconception is that you only need to take one when you're pregnant. We're going to explain why it is just as important to take it before conception as well.
Now, the most obvious component of a prenatal is the multivitamin portion. This has all the extra nutrients that mom should certainly have for herself, but also this is where there's an increased demand for supply thanks to baby. One of the most important nutrients is folate. Folate is needed very early in pregnancy and is recommended that women take it when planning to become pregnant, since folate needs are high around the time of conception. Adequate folate nutrition before and during pregnancy supports healthy brain development as well as the spinal column and ensures an overall healthy pregnancy outcome.
Another very important and oftentimes absent nutrient in a prenatal vitamin is DHA. DHA is an omega-3 fatty acid, and it's found in conjunction with EPA, which is another omega-3. Intake of omega-3 fatty acids is critically important during pregnancy for the development of fetal brain and retina. During mid to late gestation, DHA plays an important role in the development and cognitive motor functions, and an ample supply of DHA is beneficial to the baby's brain and eye development. However, most women don't get enough DHA in their diets. Thus, it's recommended that pregnant and breastfeeding women consume an additional DHA daily, particularly during the late months of pregnancy and the first few years of life, when the baby's brain is developing rapidly.
So, of course, we want to look at a little bit of research. Now, we talked about this a little bit when we were talking about our fish oil supplement that we recommend. But let's look at some research around the idea of babies and moms who get sufficient DHA. A study found that babies whose mother had had high levels of DHA at delivery had advanced attention spans into their second year of life. During the first 6 months of life, these infants were 2 months ahead of babies whose mothers had lower DHA levels. Another study showed children whose mothers took a DHA supplement during pregnancy scored higher on intelligence tests at 4 years of age compared to children of mothers not taking DHA supplements. In a separate review article, researchers concluded that decreased brain DHA represented an important potential risk factor for both depression as a whole, generally speaking, and postpartum depression in particular, as researchers found. They found that there was lower levels of DHA in mother's milk and red blood cells whenever they were found to have postpartum depression.
DHA is not only for the health of a growing baby, it's also important for the health of the mother. Thus, it's critical in supplementation while taking during pregnancy and breastfeeding. But while DHA is an important omega-3 fatty acid, EPA is left out of almost all prenatal supplements. EPA is the anti-inflammatory omega-3 fatty acid and is most beneficial when trying to conceive. Research has shown that many studies of men and women who have higher levels of blood omega-3 fatty acids have increased fertility rates compared to those with lower levels of blood omega-3 fatty acids.
Now, the particular prenatal that we like to sell in our office and that Dr. Jessica recommends to her moms or soon-to-be moms or hope-to-be moms is what's called Prenatal Complete. This is by Orthomolecular. It has all the nutrients that mom needs both before, during, and even after pregnancy, including the DHA and EPA omega-3 fatty acids. So if this is something that you're thinking about in terms of getting pregnant, you're pregnant, or you just gave birth, make sure that you have a complete prenatal that's going to help both you and baby. As always, guys, thanks for tuning in, and we will talk to you guys next week.